Hey guys, it's Dr. Kresimir. I'm a chiropractor here in London, Ontario, and today we're going to be talking about exercises and things that you can do when you tweak or put out your lower back. A couple things about this injury, when it typically happens, and I say typically, not all the time, but the majority of the time, the issue is happening around your sacroiliac or your SI joints. When those joints are negatively affected, that's what can produce that bending over pain, that feeling of instability, or even that sharp stabbing pain. Now, again, if something doesn't feel right and you're unsure, always please go contact your healthcare provider. It's always much better to make sure that it really is the SI joints that can be affected. Low back pain can be complicated, but I'm still gonna show you some exercises that you can try. Make sure that you're being safe, and again, if anything hurts or feels weird, please stop and see your healthcare provider. So the first thing, you're gonna need some, you're gonna need some props or some tools in order to help. The first thing I have here is a chair, and the first position to get in is what's called 90-90. So you want your hips at 90 degrees and your knees at 90 degrees, and just hanging out in this position oftentimes can take the pressure off your low back. It's a really comfortable position typically to be in if you've put out or injured your lower back. Another exercise you can do is you'll remove the support, but you're gonna again keep your legs at 90-90. You're gonna need both of your hands. One hand is going to be pushing down on the knee. The other hand is gonna be pulling up on the knee simultaneously, but you're going to resist that pressure and have things happen here, and then you're going to switch. You don't want to create, it doesn't take a lot of force. You can see I'm doing the exercise, and I'm more than able to keep a conversation going with you. So you don't have to use a lot of force. It's just resisting the motion that'll help balance and help the pelvis. While you're doing this, what you might hear is a pop or a clunk that could happen from your pubic bone. It could also be happening from the SIs. Typically when that happens, there's a sense of relief associated with it. So there's nothing that you have to be typically concerned with that. The next one is you're going to need a really soft, inexpensive ball. I took this from my kids. You can get them typically at Shoppers Drug Mart or a drugstore. You're gonna put it in between your legs, and you're just very gently gonna squeeze your knees together. And the same thing might happen. There might be a release from the pelvis. The last exercise that I'm going to show you is to take this ball. You're gonna be putting it on your stomach, and you're gonna be spending some time on your belly. Now, the reason that the ball is here is because when you're in this position, focus your breath through the ball. And the goal of this is to help bring more of the awareness to your core to help take the tension and the spasm out of your low back. Typically with these types of injuries, the reason that your back goes into spasm is because it's trying to hold and keep everything together. And focusing your breath through your belly can help take some of that tension outside a remover from the lower back and bring it back to your core, which is responsible for stabilizing your pelvis. Also, when you're doing these exercises, you can do them multiple times throughout the day, especially ones where you're in a relaxed position with your legs up on the chair, or whether you're belly breathing through this. The goal, and always good advice when there's any type of mechanical injury, is to keep your body moving to the best of your ability. I understand it's gonna be uncomfortable getting up and moving around, but if you can tolerate it, it's typically a good idea. We don't want inflammation just to set in and to bring more pain and less mobility into those joints. If you have any questions, please post them below. I'm having trouble speaking today, so if you have any questions, please post them below. I would love to be able to help and provide you with more value. Let me know how these exercises go, give them a shot, and we'll talk to you next time.